name's Casey Conrad, and I am making this recording of my stem cell therapy done at the Docere clinics in Park City, Utah, because after telling so many of my friends about it, they all wanted to see what it was about, especially since I've had such amazing results. This is not a paid-for movie. I was not asked to do this by anybody, and I'm not receiving any financial compensation, and just to get all that out. So, little background, I have had back discomfort for many years due to athletic overuse. For the past 4.5 years, I have lived with pretty severe back pain, and the only thing that has allowed me to manage it is using Young Living essential oils. But I was just managing the pain, and I really felt that there was a way that I could actually repair my back. And recently at a convention for Young Living oils, I heard Dr. Adelson speak. I went in for consultation and found out that I was a good candidate. My L4 and L5 are compressed with almost no space between my L5 and my S1 with a partially bulging disc. So I flew out to Park City, Utah on July 4th and had the treatment done on July 5th. Prior to the treatment, 1 hour prior, I took the Young Living, what's called the morphine bomb. That is a combination of frankincense, copaiba, and Idaho balsam for oils that Young Living distributors have found when taken internally in a vegetable capsule helps the inflammation during any type of surgical or invasive treatment. So I did that, and then I arrived at the clinic, and this is the room where they were performing it with this very large machine that is an X-ray type machine that allows them to see exactly where they're placing the needles. So the first thing that they did was they cut a small incision in my back where they created the spot to harvest my bone marrow. This is right over my iliac crest, and that would be the equivalent of a very large, thick needle, which then, as you can see the hammer that's sitting on my buttocks, he proceeds to pound that into my iliac crest. And people say, well, did it hurt? And the answer is no. I got some lidocaine beforehand, and I would say that the lidocaine needle was the only thing that really caused me to flinch. Do you feel it? Yeah, of course you feel it, because a needle is being, pounded into your iliac crest, but there was no pain, just some pressure. This is a X-ray picture that they gave me that shows, you can see off to the left, it looks like a long rectangular dark area with dots in it, and that is the end of that needle, if you will, that is extracting the bone marrow from my iliac crest. And so you can see they then pull out the bone marrow, and they actually took 2 tubes of this because they were going to do 12 injections. It's passed off to an assistant, and I asked them to take all these pictures because I couldn't see what was going on. And as you can see, I'm giving the thumbs up down there in the bottom right hand corner. Then the blood or bone marrow is placed into test tubes that are equal to the number of injections that you're going to receive, and I was getting 12. From there, they are divided up equally. I then get sutured up, and while I'm being sutured, the test tubes are put through a centrifuge, and this is to separate these stem cells from all the other matter that is in my blood. So now I get some more lidocaine. It was probably about a 15-minute process in between the bone marrow harvest and the actual performing of the stem cell therapy. So what he's doing here, as you can see, he's got a purple marker pen, and he's using the X-ray machine. You can see the pictures up in the back to locate exactly where he wants to do the injections. There's the needle. You really can't see the whole thing. It's going up into that gauze pad, but you'll see it in a second. So there's the length of the needle. I didn't ask the length, but it's pretty long. And he inserts it using the X-ray machine to find exactly where he wants to place it, and he is putting it there between my L5 and my S1, and there you can see he's got it exactly where he wants it. And this, I think, is the coolest picture of all. You can see where the red arrow is, and you can see there is almost no space between my L5 and S1, and the needle, he has gotten it dead smack right in the middle with the tip of it in right dead center in the vertebrae, and then he injects that vertebrae with the stem cells. Now this is probably the only time, I mean, you feel pressure, right? It's like someone's filling you up, but it wasn't painful. It was just a slight pressure. Then rinse and repeat. I was having 2 injections, one in between my L5 and S1 and one between my L4 and L5, and then he proceeded to do stem cell therapy around those 2 vertebrae in the attachment points where a lot of the pain actually is caused when you have scar tissue in your back. So you can see he just continued to place the needles, and this I thought was really cool. You can see I've circled where those 6 injections were happening at that moment. I also had my sciatica, both of those injected, and that little squiggle up at the top with the 2 balls on the end of it, yes, that is my belly button ring. I thought that was kind of fun. And there is my backside, where you can see the lower right hand dot is the incision point for the bone marrow harvest, and then all those other spots were where I had stem cell injections done. And there I am. I think from the time I sat down on the table or lie down on the table to the time I was up, it probably was an hour, maybe an hour and 20 minutes maximum. I was in and out of the clinic in a total of 2 hours. Post-procedure, I have been using, of course, Young Living essential oils. I took another morphine bomb and then began using all of the anti-inflammatory oils that Young Living has. Now, post-procedure, you actually go out and you walk for 2 to 3 hours to get the blood circulating and to get things moving around to stimulate that. You cannot use any ibuprofen and any ice post-procedure, which is why Young Living oils are so important, because they provide a natural anti-inflammatory that doesn't override your body's natural pain receptor sites. So this is what causes the healing aspect of the stem cell therapy injections. So that's my experience. I have been pain-free since having the procedure. Now, I'm 12 days out, and yes, my iliac crest is still sore if I lie down on the floor. Like this morning, I took yoga, and when I was in Shavasana, lying on a hard floor, yes, my hip was still slightly sore, and I'm a little stiff, but I have had no pain since having the procedure, and that is an amazing thing, because for the last 4 years, I've woken up just about every morning with low back pain and have to do, child's pose and some other things just to get myself warmed up. So I'm super excited. I know that it's just going to continue to get better and better. My flexibility is already improved, probably because the, inflammation is down and the recovery. So I can only give it a thumbs up, and for those of you who really wanted to see all of it, I hope that the pictures weren't too graphic for you. Again, this is Casey Conrad, and I hope you've learned a little bit about stem cell therapy.